Assessing mental status is a fundamental topic for nursing practice, as mental health is just as important as physical health. A well-conducted mental status assessment allows us to understand a patient's cognitive, emotional, and psychological well-being. It also helps us detect early signs of mental health disorders and provide timely intervention. Mental health is not just the absence of illness. It is a state of well-being where individuals can cope with stress, work productively, and contribute to society. According to the World Health Organization, mental health is essential for overall well-being. On the other hand, mental disorders are conditions that cause significant distress or impairment in thinking, mood, or behavior. This can range from anxiety and depression to more severe conditions such as schizophrenia and bipolar disorders. As nurses, understanding these disorders helps us assess patients holistically because mental health affects physical health and vice versa. Now let's talk about our role as nurses. Nurses are often the first healthcare professionals to notice changes in a patient's mental status. We assess patients for signs of emotional distress, cognitive impairment, or behavioral changes. Our responsibilities include conducting mental status assessments, including evaluating mood, cognition, and behavior. Identifying risk factors such as stress, trauma, or family history of mental illness. Providing a safe environment and emotional support for patients in distress. And referring patients for further psychiatric evaluation when necessary. We must also be skilled in therapeutic communication, such as listening actively and responding with empathy to build trust with our patients. Many factors contribute to a person's mental health. These include biological factors. These are the genetics, neurotransmitter imbalances, and brain injuries that can predispose individuals to mental disorders. Psychological factors such as trauma, coping skills, and self-esteem play a role in how people manage stress. Social and environmental factors. These include relationships, socioeconomic status, cultural background, and access to health care all impact mental health. Medical and physiological factors can also impact mental health. Many chronic illnesses have been linked to mental health disorders, particularly depression and anxiety. Chronic illnesses such as diabetes and heart disease can significantly contribute to depression. Managing these conditions often involves lifestyle changes, ongoing medications, and sometimes physical limitations, all of which can take a toll on mental well-being. For example, a patient with uncontrolled diabetes may feel frustrated about dietary restrictions or experience emotional distress from fluctuating blood sugar levels. Similarly, individuals with heart disease may develop anxiety about their health and future. Medication side effects can also impact a person's mental state. Many commonly prescribed drugs, such as steroids, antihypertensives, and even some antibiotics, can cause mood swings, confusion, or cognitive impairments. Patients who take multiple medications, especially older adults, may experience these side effects without realizing they are medication related. As nurses, it's crucial that we assess whether a patient's mental health symptoms are due to an underlying medical condition or a medication reaction. Understanding these factors allows us to develop a patient-centered approach when conducting assessments and planning interventions. Let's briefly discuss some common mental disorders. We have mood disorders. These include depression and bipolar disorder, which affect emotional stability and daily functioning. Anxiety disorders, such as generalized anxiety disorders, panic attacks, and phobias, which can be debilitating. Psychotic disorders, such as schizophrenia, as characterized by hallucinations, delusions, and impaired thinking. Personality disorders, which include conditions like borderline personality disorder that affect how individuals relate to others. Cognitive disorders. Dementia and Alzheimer's disease lead to progressive memory loss and cognitive decline. Recognizing early signs and symptoms of these disorders helps nurses provide appropriate interventions and support. Substance abuse is closely linked to mental health. Many individuals use substances such as alcohol, nicotine, and illicit drugs as a way to cope with stress, anxiety, or depression. However, substance abuse can lead to dependence, withdrawal symptoms, and worsening mental health conditions. As nurses, we screen patients using tools for alcohol dependence and to assess substance-related risks. It is important to approach this topic with sensitivity, offering support rather than judgment. Assessing mental status is a crucial component of health assessment. Mental health and mental disorders affect overall well-being, and nurses play a critical role in identifying risk factors, conducting assessments, and providing compassionate care. Understanding factors that influence mental health, recognizing signs of common mental disorders, and addressing substance abuse help us support our patients holistically. Remember, mental health matters. As future nurses, you will be advocates for your patients' well-being, both physically and mentally. Mental health assessment is a crucial aspect of nursing practice as it provides valuable insight into a patient's cognitive, emotional, and psychological well-being. When we assess a patient's mental status, we are not just looking for mental disorders. We are also evaluating their overall psychological health, which affects how they think, feel, and interact with others. A large part of this assessment involves collecting subjective data, which means gathering information directly from the patient through structured interviews. This data allows us to identify potential mental health concerns early and plan appropriate interventions. Now let's break down the key components of this assessment, starting with biographical data. When we begin a mental health assessment, we first collect the patient's biographical data, which includes, among others, their name, age, gender, marital status, occupation, and cultural background. Why is this important? First, collecting biographical data helps us establish rapport and build trust with the patient. People are more likely to open up about sensitive mental health factors and mental health concerns when they feel comfortable. Second, demographics can influence mental health risk factors. For example, certain mental disorders are more prevalent in specific age groups and cultural backgrounds and can shape a person's understanding and response to mental health conditions. Finally, this information provides baseline data that helps us track changes over time. Once we gathered biographical data, we move on to understanding the patient's current mental health concerns. To get a clear picture of a patient's mental status, we ask about their current symptoms. Key areas to explore include mood changes. Are they feeling sad, anxious, or irritable? Behavior alterations. Have there been changes in social interactions or daily activities? Cognitive issues. Are they experiencing memory problems, confusion, or difficulty concentrating? Stressors. Are they dealing with personal or professional challenges? Sleep and appetite disturbances. Poor sleep and appetite changes can be signs of underlying mental health concerns. Substance use. We assess whether the patient uses alcohol, tobacco, or other substances that may be impacting their mental health. Why do we ask these questions? To help us identify the primary complaint and whether the issue is acute or chronic. They may also guide the need for further assessment or specialist referrals. Now we'll look at the patient's personal health history, which includes past mental health conditions. Have they been diagnosed with depression, anxiety, or any psychiatric disorders before? Previous treatments. Have they taken medications like antidepressants, mood stabilizers, or antipsychotics? If so, were they effective? History of self-harm or suicide attempts. This is a critical factor in assessing risk and ensuring patient safety. Why do we ask these questions? A history of mental illness increases the risk of recurrence. Medication history helps determine if current symptoms may be due to side effects or withdrawal. Identifying patterns of deterioration or improvement helps in planning appropriate care. Mental health conditions often have a genetic component, so we assess family history by asking about a family history of depression, schizophrenia, bipolar disorder, or anxiety disorders. Any substance abuse issues or suicide attempts in close family members. Why does family history matter? Genetic predisposition plays a major role in mental health. Knowing a family history of mental disorders can guide risk assessments and preventive measures. Understanding family support systems helps in our care planning. A strong family support network can be a protective factor, while a dysfunctional one can contribute to mental health issues. A person's lifestyle choices can greatly influence their mental health. Here is what we assess. Diet and nutrition. Poor nutrition, such as vitamin deficiencies, can affect mood and cognition. Exercise. Regular physical activity has been shown to reduce stress, anxiety, and depression. Sleep habits. Insufficient or poor quality sleep impacts cognitive function and emotional well-being. Substance use. Alcohol, drugs, smoking, and even caffeine intake can alter mental health. Social interactions. Do they have a strong support system, or are they feeling isolated? Why do we ask these questions? Lifestyle factors can exacerbate mental health conditions or alleviate symptoms. Understanding daily habits helps in formulating realistic interventions. Now let's discuss some key mental health assessment tools that we can use in gathering subjective data. 1. The Alcohol Use Disorders Identification Test. The purpose of this is to screen for hazardous or harmful alcohol use. This is a 10-item questionnaire assessing alcohol consumption, dependence, and consequences. This tool helps detect early signs of alcohol dependence and guide intervention strategies. The quick inventory of depressive symptomatology is used to measure depression severity over the past 7 days. This is a 16-item self-reported questionnaire that evaluates mood, sleep, appetite, and psychomotor activity. This tool helps diagnose major depressive disorder and monitor treatment response. The modified SAD person's suicide risk assessment is used to assess suicide risk based on key factors. This evaluates the sex, age, depression, previous attempts, ethanol abuse, rational thinking loss, social support deficits, organized suicide plan, no spouse, sickness or medical illness. Scoring ranges from 0 to 10. This tool helps identify individuals at risk for self-harm or suicide and ensures appropriate intervention. To recap, we have the following key points. Mental status assessments require a structured approach to collect subjective data effectively. Biographical data, history of present illness, personal and family history, and lifestyle factors all play a role in mental health. Assessment tools can help standardize mental health evaluation. As nurses, we must be compassionate, thorough, and non-judgmental in our assessments, ensuring our patients receive the care and support they need. Mental health is an essential part of overall well-being, and by conducting proper assessment, ensuring patients receive the care and support they need. Mental health assessment is an essential part of a comprehensive physical examination. Unlike subjective data, which is based on a patient's self-report, objective data is gathered through observation, structured assessments, and standardized tools. The goal of this assessment is to evaluate a patient's cognitive, emotional, and psychological well-being, helping to identify neurological conditions, psychiatric disorders, and any cognitive impairments requiring further intervention. Mental status assessment includes both general routine screening and focused specialty assessments, which we will discuss. In nursing practice, mental status assessments are conducted at different levels. The general routine screening is performed on all patients as part of a standard health assessment. It includes evaluating the patient's alertness, behavior, appearance, speech, and cognitive function. This screening helps determine if a more detailed assessment is needed. The focused specialty assessment is conducted when cognitive or emotional impairments are suspected. This involves a deeper evaluation of consciousness, cognition, mood, thought process, and perception. This uses specific tools such as the Glasgow Coma Scale, the Mini-Cog, and PTSD screening tools. By distinguishing between these two approaches, we ensure that patients receive appropriate mental health care based on their needs. Before conducting a mental status assessment, proper preparation of the client is needed. Establish a comfortable environment. These reduce distractions and ensure privacy to promote open communication. Use a calm and reassuring tone to ease patient anxiety. Explain the purpose of the assessment. Inform the client that their responses will help evaluate cognitive and emotional health. Address any concerns about sensitive topics in a non-judgmental manner. Consider cultural and language differences. Use interpreters if needed to ensure accurate responses. Be mindful of cultural norms that might influence patient behavior or communication. For objective mental status assessment, we use several essential tools, including paper and pencil. These are used for cognitive tests such as drawing figures or recalling words. The Glasgow Coma Scale. This assesses the level of consciousness using eye, verbal, and motor responses. The PHQ-2 and PHQ-9, which are used for depression screening. The Columbia Suicide Severity Rating Scale could also be used to evaluate suicide risk in patients. The Primary Care PTSD Screen for DSM-5 is used to screen for post-traumatic stress disorder. The St. Louis University Mental Status or the SLUMS exam is used to detect cognitive impairment. And the Alcohol Use Disorders Identification Test could also be used to assess alcohol dependence and misuse. These tools allow us to objectively measure mental and emotional functioning. Assessing the level of consciousness is a critical component of mental status evaluation. The assessment procedures include 1. Observe the patient's general appearance and responsiveness. Assess alertness. Does the patient respond to verbal or physical stimuli? Evaluate orientation. Ask the patient for their name, current date, location, and situation. Examine speech, thought processes, and memory for coherence. Normal findings include the patient is alert and responsive, oriented to time, place, and person. Speech is clear and logical. Abnormal findings could include disorientation, confusion, or unresponsiveness, slurred or incoherent speech, memory deficits or inappropriate responses. For example, a patient with severe dementia may struggle to recall their own name or current location, indicating significant cognitive impairment. Next, we evaluate the cognitive functions of the patient. What are the key cognitive functions? Orientation to time, place, and person, attention span and concentration, recent and remote memory, abstract reasoning and judgment. How do we assess for these functions? Ask for the current date and location. Have the client recall recent events. For example, you may ask, "What did you have for breakfast?" Ask about long-term memories, such as, "Where did you grow up?" Use problem-solving questions. Normal findings include accurate recall of recent and remote events, logical reasoning and problem-solving skills. Abnormal findings include difficulty remembering recent or past events, poor judgment and problem-solving ability, impaired concentration or inability to maintain attention. The mental health assessment tools help us evaluate a patient's level of consciousness, cognitive function, and psychological state. These tools provide objective measures that assist in diagnosing and monitoring mental health conditions. These tools serve a specific purpose in assessing brain function, memory, cognitive impairment, post-traumatic stress, and substance withdrawal symptoms. The Glasgow Coma Scale is widely used to assess a patient's level of consciousness, particularly in cases of brain injury, stroke, or neurological disorders. It evaluates three major areas. The eye-opening response, 1 to 4 points. 4 means spontaneous. The eyes open naturally. 3 opens eyes to voice. 2 opens eyes only to painful stimuli. 1 no eye opening. Verbal responses, 1 to 5 points. 5 means oriented, answers questions appropriately. 4, confused but can respond verbally. 3, inappropriate words, such as random speech and doesn't make sense. 2, incomprehensible sounds, such as moaning or groaning. 1, no verbal response. Motor response, 1 to 6 points. 6, obeys commands or moves as directed. 5, localizes pain, tries to push away painful stimuli. 4. Withdraws from pain. Pulls away but no purposeful movement. 3. Abnormal flexion. Decorticate posturing or arms flexed inward. 2. Abnormal extension. Decerebrate posturing or arms extended outward. 1. No motor response. The total GCS score ranges from 3 to 15 with the following interpretations. A score of 15 means normal level of consciousness. 13 to 14, mild impairment, such as in a possible confusion or disorientation. 9 to 12, moderate impairment. There is decreased alertness and inability to follow commands. Less than 8, severe impairment, such as in coma or unconsciousness. For example, a patient with a score of 6 may be unresponsive and only exhibit abnormal posturing, whereas a patient scoring 12 may be confused but still able to respond. This scale is critical in emergency settings to track neurological deterioration or improvement. The mini-cog is a quick and effective screening tool used to detect cognitive impairment, particularly in older adults. It is often used in primary care and hospital settings to assess for early signs of dementia. Steps in the mini-cog assessment includes the 3-word recall test. The patient is given 3 unrelated words to remember. They are asked to recall them later in the assessment. Clock drawing test. The patient is asked to draw a clock showing a specific time. This assesses executive function and visuospatial skills. Word recall. The patient is then asked to recall the 3 words given earlier. Interpretation. A score of 3 or lower suggests possible dementia or cognitive impairment and may warrant further testing. A normal score 4 or 5 suggests intact cognitive function. For example, if a patient forgets 2 out of 3 words and cannot accurately draw a clock, this raises concerns about early Alzheimer's disease or mild cognitive impairment. The 10 signs and symptoms of Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, problem solving, and behavior. The 10 early warning signs include memory loss that disrupts daily life, challenges in planning or problem solving, difficulty in completing familiar tasks, confusion with time or place, trouble understanding visual images or spatial relationships, new problems with words in speaking or writing, misplacing things or losing the ability to retrace steps. Decreased or poor judgment, withdrawal from work or social activities, and changes in mood or personality. If a patient frequently misplaces objects, struggles to recall daily events, and withdraws from social interactions, further neurological evaluation is needed. The primary care PTSD screen for DSM-5 is a brief screening tool used to identify individuals who may have post-traumatic stress disorder. It consists of 5 yes or no questions assessing exposure to traumatic events, intrusive memories, avoidance behaviors, and hyperarousal symptoms. If a patient answers yes to 3 or more questions, further psychiatric evaluation is recommended. For example, a combat veteran who reports nightmares, avoids crowded places, and startles easily would likely require further PTSD assessment. The Clinical Institute Withdrawal Assessment for Alcohol is used to monitor alcohol or drug withdrawal symptoms. It assesses tremors, shaking of hands or body, sweating, increased perspiration unrelated to activities, anxiety, feelings of nervousness or restlessness, agitation, inability to stay still, pacing or fidgeting, hallucination, seeing or hearing things that aren't there, seizures, uncontrolled muscle contractions or loss of consciousness. A high CIWA-AR score indicates severe withdrawal and may require medical intervention to prevent complications like delirium tremens. Common levels of consciousness abnormalities include lethargic, sluggish, drowsy response to stimuli, obtunded, requires repeated stimulation to respond, stuporous, minimal movement, responds only to painful stimuli, comatose, no response to verbal or painful stimuli. For example, a stuporous patient may require vigorous shaking before responding, while a comatose patient remains unresponsive despite repeated attempts. Speech disorders can indicate neurological or muscular impairments. What are the common speech and voice disorders? Dysphonia, hoarseness, weak voice due to laryngeal disorders or cranial nerve 10 impairment. Cerebellar dysarthria, irregular, uncoordinated speech due to multiple sclerosis or cerebellar damage. Dysarthria, slurred or slow speech from Parkinson's disease, stroke, or muscular disorders. Aphasia, language impairment due to brain damage. We have Wernicke's aphasia. The person is fluent, but the speech is meaningless. Broca's aphasia. Slow, difficult articulation, but meaning remains clear. To summarize, objective mental status assessment evaluates consciousness, cognition, and speech. Standardized tools aid in assessing mental and neurological function. Recognizing abnormalities enables early intervention. After collecting subjective and objective data, the next step is to identify abnormal cues and client strengths. We do this by clustering related data to determine significant patterns and abnormalities. As nurses, we must distinguish between opportunities to improve health, risks for mental health concerns, actual client concerns, and collaborative problems that require medical management. Let us now go through the process of identifying and clustering data to recognize patterns. Step 1. Identify abnormal findings. For example, a patient reports frequent forgetfulness, difficulty recalling names, and getting lost in familiar places. Step 2. Recognize client strengths. When a patient experiencing anxiety actively seeks counseling and support groups, which is a positive step toward mental well-being. Step 3. Cluster related data. For example, a combination of confusion, memory loss, and difficulty performing daily tasks may indicate early cognitive impairment or dementia. Step 4. Classify the concern. If a patient requests help for substance use, this is an opportunity to improve health. If a client has depression with suicidal thoughts, this is a risk for suicide. If a patient presents with anxiety due to memory loss, this is an actual client concern. If a patient has seizures related to brain injury, this is a collaborative problem requiring medical intervention. Some clients actively seek ways to improve their mental health. For example, when a 45-year-old patient states, "I think I drink too much and I want to quit," you may conclude the patient has an opportunity to improve health related to substance abuse treatment. For our nursing actions, we can provide education on treatment options, refer the client to support groups. For this case, example is Alcoholics Anonymous. Encourage motivational counseling and relapse prevention strategies. Patients who express a desire to change should be supported and encouraged to take proactive steps toward recovery. Some clients may be at risk for severe mental health issues. One risk could include risk for suicide. This is associated with depression, suicidal thoughts, lack of support, and loss of significant others. Example of this could be that 22-year-old college student who recently lost his parent and said, "I don't see the point in living anymore." Our nursing actions could include conducting a risk screening, and for this case, we can use the Suicide Risk Screening Modified SAD Persons Scale. We can engage mental health professionals for crisis intervention and ensure immediate safety measures such as monitoring and hospitalization if necessary. Risk for delayed growth and development. This is associated with living in a confined or unhealthy environment that limits activity and stimulation. Example is a 6-year-old in foster care displaying poor social skills and emotional regulation. We can refer the client to pediatric developmental specialists and promote early intervention programs to support cognitive and emotional growth. Early identification of risk factors allows for preventive interventions and better health outcomes. There are actual client concerns that require nursing intervention. Example could be anxiety related to memory loss. This could be presented by a 70-year-old client who frequently forgets appointments and says, "I'm afraid I'm losing my mind." As a nurse, we can offer reassurance and education on memory support strategies and assess for early signs of dementia. Confusion related to dementia or head injury. This could be a problem, especially, for example, a 55-year-old patient who mixes up names, misplaces items, and has trouble concentrating and conversing. We can conduct the mini mental state exam and assess for neurological conditions such as stroke or traumatic brain injury. Identifying these concerns allow us early intervention and supportive care. Some mental health conditions require both nursing and medical management. These are known as collaborative problems. Common collaborative problems include stroke, increased risk due to hypertension or previous stroke history, increased intracranial pressure. Symptoms could include severe headache, confusion, vomiting. Seizures. This may result from brain injury, epilepsy, or alcohol withdrawal. Meningitis. Symptoms could include stiff neck, fever, and altered mental status. Depression. Persistent low mood, loss of interest, and social withdrawal. As nurses, we must monitor symptoms, prevent complications, and collaborate with primary healthcare providers. Some mental health symptoms require urgent medical referral. When to refer: sudden memory loss, extreme confusion, rapid personality or behavior changes. Nursing actions could include documenting the symptoms, notifying the provider, and ensuring a safe environment. Referring clients for early evaluation can lead to timely diagnosis and treatment. In summary, data clustering helps nurses distinguish between normal and abnormal mental status findings. Client concerns can range from mild anxiety to severe memory loss requiring medical intervention. Collaborative problems require monitoring and physician-led treatment. Sudden cognitive decline and severe confusion require immediate referral. By applying these skills, we will be able to make informed clinical decisions that improve patient outcome.